if this is being used without control, then it will pose a lot of threats to our future generations.
We are living in a world filled with probability. We are born because of probability as well, and so do all the traits that we inherit. And what happens if the genetic codes that we inherit in our body malfunction? So there comes the genetic disease. And what is the most common genetic disease? Color blindness. And according to a study reviewed by the American Academy of Ophthalmology, they revealed that the Caucasian boys have the highest chance of getting color blindness with the rate of 5.6% in a cross of 4,000 participants. And what if you're one of them? You're gonna freak out because you cannot see the true colors of nature for the rest of your lives. But in the future, there is a cure for that. And so I would like to introduce everyone about gene therapy.
Good afternoon, Dr. Teng. Nice to meet you. I'm Wei Ling. Thanks for coming to share your knowledge about the gene therapy with us. Can you briefly tell us about the gene therapy that's popular nowadays?
Like all of you will know, it's a trend nowadays that gene therapy is something like when you want to treat a disease using drugs or surgery. Instead of doing so, you are trying to using a gene, or you try to correct the genes of a patient so that you can kick off or you can stop the disease or the disorder.
So now I would like to introduce my friend Lim William to talk about the process of gene therapy. So please enjoy.
I'm William. Now I'm going to explain about the gene therapy. Gene make us who we are. Are we tall or short? Do we have blue eyes or brown? And only our gene hold the answer. What if part of the gene is defective or missing? It can cause disease, a serious disease like cancer. So, gene therapy is introduced. They replace a bad gene with a healthy one. How do scientists do it? Of course, they need an efficient way. Scientists use vectors or vehicles to deliver a gene. Then, the healthy gene hitches right in the vector. Viruses are one kind of vectors. Scientists modify a virus to remove its ability to cause a disease. So, it can be used to carry a healthy gene into a cell. The gene therapy can be undergone on cells inside or outside and transplanted back in again. Gene therapy holds great promise for a healthy future. Simple speaking, gene therapy is just a process of inserting a modified viral vector into the patient body. Then the older gene will be replaced, and finally the disease is cured.
Do you think that is there any side effect?
Present, actually, they are still under clinical trials. I would say that there is risk for any kind of a treatment, including surgery. As for the gene therapy, there will be a high risk of those uncertainty.
Since doctor, you are teaching ethics and science, is that gene therapy ethical from your own perspective?
It can be helping people, or at the same time, it may cause some unwanted effects. If they will want to help patients with cancers or inherited disease, then I would say this is a very good approach of doing so. But if you want to ultimately change certain genes of human, for example, to look more handsome, or forcefully want to change some traits or characteristics of human, then I will say this will be the side effects.
Hi, my name is Eric. Today I will interview SMUM students about gene therapy. Let's go! Hello, nice to meet you. First of all, I want to ask you, did you know about gene therapy?
Yes.
No, I'm sorry, I don't really know about that.
No.
Yes.
Yes. Okay. So if you know the gene therapy, will you support the gene therapy and why?
I would support because from what I know, gene therapy, they use it to cure genetic diseases that otherwise cannot be cured by medicine.
Will you support gene therapy and why?
I will support it because I think that will improve our life.
For now, no, because it has not many research or information.
For me, yes. So gene therapy is used to cure rare diseases. So why not we give it a try?
What's your opinion about the future of gene therapy in medical field?
I think the future is quite bright because gene therapy, it can go beyond curing diseases.
Maybe we can become smarter in the year or become taller.
I believe in human that we can create more humans with intelligence, or maybe children with better genes.
Do you think isn't it morally wrong if you correct the genes?
No, for me it's no.
Okay. And one last question, will you use gene therapy if you inherit genetic disease?
Sure, if I can afford it, I will sure use it.
Yeah, that's it. Yes.
Yes.
Depends on how reliable gene therapy is at the time.
That's all for our interview. Thank you for your time.
Thanks.
Meanwhile,
Thank you, Daniel. And we are now at KIA. Now I will go to find some people to ask some questions about gene therapy. Let's go! Sorry sir for your interruption. My name is Kang. Do you know what's gene therapy?
Sorry, no, I'm not quite familiar with this topic.
Okay. Do you know about gene therapy?
A little bit, yes.
Okay. Okay, you'll be good. The first question, do you know what's gene therapy?
No.
Okay. Do you think that is gene therapy ethical for you?
Yes.
Yes. Okay. Do you think that is the gene therapy ethical for you?
Sounds like it's okay.
It's okay.
Yeah.
Okay. Is gene therapy ethical for you?
Ethical for me in which sense?
Which means it's like morally correct.
I mean, I don't know much about it, but if it is what it is, then yes.
Your family, like your children or maybe your parents, have faced a genetic problem. So would you carry on a gene therapy for them, even though the cost is very high?
If it was a solution, yes, I would.
Okay. Gene therapy is replacement of detective gene into the normal one to cure the genetic disease like colorblind and Down syndrome. Okay, do you think that is gene therapy ethical for you? Yes or no?
Yes.
You family, like your parents or children having the genetic problem, will you conduct a gene therapy even though the cost is very high?
I think it really depends on the situation. It depends on like what is the morality in the family, and the second thing is the financial situation in the family, whether they can support for this gene therapy. But for me, I don't think this is ethical because we shouldn't be going against of the nature of science.
Okay. Thank you.
So, most people in our country have no idea about what gene therapy is. Even if they do, they only have a vague idea about what it is, what it can do, what it can provide. And I think that if the government do not seriously promote this gene therapy, even it is being open to the public, if the public themselves have no idea about this kind of futuristic medication, will never take off seriously because they have no idea about the cost, about the side effects, about how the process is being done. And I think that one of the most simple and yet important solution to this is having a great promotion if it's being opened up to the public. And by that, I think that our future generation will really have a good health, because if you look at the bright side, this will really change the future of humanity. So that's all for today's video, and I will see everyone next time. Like and subscribe. Peace out.